So guys, question is, a patient suffer a fracture of femur head. He had an open treatment of the femoral head with replacement using a Medicon alloy femoral head and methyl methicillate cement. How would you report this procedure? So in this question, we should focus key point. Here I am going to highlight like a patient suffer a fracture of femur. So fracture happen on femur head. He had an open treatment. So it's an open fracture. Open and close fracture. There are two type of fractures. This is open treatment of femoral head with replacement using a Medicon alloy femoral head. So replacement also done. So internal fixation and replacement both we can consider here. Then how would you report this procedure? So first code is a 27236. So this is a 27236. The description for this code is open treatment of femoral fracture, proximal end, neck, internal fixation or prosthetic replacement. So I am feeling this is more appropriate. Okay, also we have other codes also, so we will check the description for other codes also. So like 27235. So 27235 is here. Percutaneous skeletal fixation of femoral fracture, proximal end. Okay, so femoral fracture is there, but percutaneous skeletal fixation. So there is no skeletal fixation. So this is this option we can eliminate. So this is eliminated. Also 27238. 27238. So this is closed treatment. So in our question there is a open treatment, so this is closed treatment, and here they have mentioned without manipulation, but internal fixation and all done. So this is also we can eliminate. So we have two options. In that 27236 is common. Also we will check 27275. 27275. Okay, so 27275 is manipulation of hip joint requiring general anesthesia. So no, hip joint manipulation and anesthesia, but as in our question there nothing has been mentioned like that hip. So this is happened for femur only, and not mention any anesthesia given or what. So option third also wrong. So the correct answer is option A, 27236. 27236. Open treatment of femoral fracture, proximal end, neck, internal fixation and prosthetic treatment. So prosthetic replacement also done and internal fixation also they have done. I hope you guys understood. So we will jump into the next question. So guys, question is, what modifier should you report when the same physician provided a reduction of fracture? First of all, they ask modifier and then re-reduction of the fracture. So re-reduction means repeated, subsequent. So the question is like here you can see the same physician. They have mentioned same physician has provided. So the question is 76, 59, 77 and 54. If you can say the description of this modifier, then you can say the 76 is for repeat procedure or services by the same physician, 59 is for distinct procedural services, 77 is repeated by the different physician, and 54 is for surgical care. If you feel it is very new for you, then always go and check the CPT book. So I will suggest to, whenever you are checking in CPT book and the code description, before every chapter you can find the guidelines like that, musculoskeletal system, and in the bracket they have mentioned the guideline how to report the CPT codes, and the criteria is also mentioned like manipulation, traction, close treatment. So if you can read these things, then you will come to know the fixation and reduction. So everything, it will be very easy to find out the correct answer. So they have mentioned here in question re-reduction fracture by same physician. So just we will search here re. Okay. So okay, correct. Re-reduction of the fracture dislocation. Okay, so if you can read this para completely, so here manipulation, reduction by the application of manual applied force or traction to achieve satisfactory alignment of fracture or dislocation. If the satisfactory alignment reduction is not maintained and required subsequent reduction of the fracture or dislocation by the same physician or same qualified healthcare professional, then append modifier 76 to fracture dislocation treatment code. So if you can read and if you come here correctly, then you will find the answer is very simple, 76. So the correct answer is 76A. Let's see next question. So guys, question is, a patient suffer a penetrating knife wound to his back. A surgeon performed wound exploration with enlargement of site, debridement and removal of gravels from the site. The surgeon decided the laparotomy procedure was not necessary at this time. How would you report this procedure? So guys, if you can highlight the key point here. So I will go and check first. The patient suffer a penetrating knife wound to his back. So wound on back. A surgeon perform a wound exploration with enlargement of the site, debridement. So surgeon has performed then wound exploration with enlargement of site, debridement and removal of gravels from the site. And then next, the surgeon decided a laparotomy procedure was not necessary at this time. How would you report this procedure? So here laparotomy, but I am not going to highlight. Why? Because there is very clear, they have mentioned like the surgeon decided a laparotomy procedure was not necessary at this time. If it is not necessary, that means he has not performed. So the thing is, the surgeon performed wound exploration on his back. So we will find out the answer. So first option is the procedure is bundled with the laparotomy. The procedure is bundled with the laparotomy, but laparotomy has not performed. Here they have mentioned the surgeon decided laparotomy procedure was not necessary. If it is not necessary means not performed, then how it can be bundled in the laparotomy? So the first option is we can eliminate, no need to think. Then we have B, C and a D. So we will check one by one CPT code description. So first of all 49000, I will check 49000. So 49000 description is exploratory laparotomy. Okay, but laparotomy has not performed. Okay, laparotomy not performed, then 49000 we can't report. So more probably B and C both will be eliminated, because laparotomy not performed means we should not bill 49000, and 49000 is given in B and C in both. So we will check the 2 series code like 20100. Okay, so here you can see 20100 is exploration of penetrating wound and location is neck. So as per our question, the location is back, not neck. So if it is neck, then we should eliminate 20100 also. So just eliminate 20100 as well. So that means option B also eliminated. But option C, 49000, this is also eliminated because laparotomy has not performed and given 49000. So 20102 will be the correct answer. 20102 is given here itself. Okay, exploration of penetrating wound and location has given abdomen, flank and back. So back means this is the appropriate answer. 20102 is our, so the option will be D. Why not C? Because of 49000 is given here also, and 59 we can't bill. Whenever we are billing two different CPTs and having NCCI edit conflict, that time only distinct service modifier we are using. So here only one procedure code is required, that is 20102. So I have taken 2-3 minutes because I am explaining, but if I would have attend the question, that means within 30 seconds I'll get the answer, like because of laparotomy not performed and laparotomy code is given in B and C also, that means the answer is D. So A, B, C we can eliminate within a 10-15 seconds. So try to eliminate. We will jump into the next question. The question is, while playing at home, Relay dislocated his patella when he fell from a tree. The surgeon documented an open dislocation. The Relay underwent a close treatment under anesthesia. How would you report the treatment and diagnosis? So guys, in this question, the patient dislocated his patella. So dislocation on his patella when he fell from the tree. So he fell down from a tree and the surgeon documented an open dislocation. So surgeon has mentioned it is an open dislocation and underwent a close treatment under anesthesia. So how would you report the treatment and diagnosis? So here in this question you can find the CPT code, means procedure code, as well as a diagnosis code they have given. So first of all we will find out the common CPT codes in a question. So if you can see here, 27562 is there in B, C and in D option also, and 27420 and 27840 is there in A and B. So first of all we will check the code description. So we know, right, the patient dislocation is on patella, open dislocation and close treatment they have done. So 27420, the first CPT code we will check out. So 27420 is close treatment of ankle dislocation without anesthesia. Ankle dislocation, but here it is patella. So ankle and knee location anatomically is different, and it is, they have mentioned in a CPT code it is without anesthesia, but here you can see under anesthesia. So the 27420 is completely wrong option, so this is eliminated. 27420, if there is in any other option, that time also we can go with elimination. So 27420 is there in option A only. Now we will check option B, 27560. 27560. 27560. So here 27560 is close treatment of patellar dislocation without anesthesia. Okay, 27562 is there. 27562. Okay, so now you can see 27560 is without anesthesia and 27562 is required anesthesia. So the complete description will be like that: close treatment of patellar dislocation require anesthesia, means with anesthesia. 27562 is appropriate as of now. Like here you can see close treatment of patella and also anesthesia has given. So I'm thinking this is, so this CPT is correct, but this CPT given in 3 options. So we need to find out which option will be the correct. So CPT is correct, but we will check out option C, 27840 also given. 27840. So 27840 is close treatment ankle dislocation, but this is not ankle dislocation. So this is wrong CPT code. So we can eliminate C option also because of 27840. So we can eliminate. So now we have two options, option B and D. So the difference, there is no CPT difference. 27562, 27562, and also diagnosis code also is S83.006A, and here also same. So only difference is here external cause code has been given in option B, and in option D there is no external cause code. So we will check the W14, the description of external cause code. So here you can see W14 dot triple XA is fall from tree. So this is the correct. Like here you can see the patient is fell from tree, and Y92.017 is okay, garden or yard in a single family private house. So it is a correct because the playing at home. So external cause code also required in this case. So the option B is appropriate. So option D is inappropriate because there is no external cause code. So the answer is B. So like that, guys, you need to find out if there is an CPT code is same in all the option, then you should go with the diagnosis code to find out the correct answer. So let's jump into the next question. The question is code for revision of total shoulder arthroplasty, including allograft when performed, humeral and glenoid component. So there is no confusion, like every option having single CPT code. So first of all, we should focus on what procedure they have done. Code for revision. So they have done revision for total shoulder arthroplasty, including allograft when performed, humeral and glenoid component. So humeral and glenoid component also there, including allograft. So the we will check one by one CPT code. So 23472. 234 23472. Okay, so 23472 is arthroplasty, glenohumeral joint, total shoulder, and then second code is 23473 is here. 23473 is a revision. Okay, so in our question they have mentioned revision of total shoulder arthroplasty. So revision means we will go with the revision only. Revision of total shoulder arthroplasty, including allograft when performed, humeral or glenoid component. So humeral and glenoid component. So this is more appropriate. And also 23474 is here, humeral and glenoid component. So in our question they have mentioned and, not or. So the thing 23474 is correct. Revision of total shoulder arthroplasty, including allograft when performed, humeral and glenoid components. So 23474 is correct answer. And the last CPT code 29827 we will check. 29827 is rotatory cuff repair. Okay, rotatory cuff repair. If you can go with the parental code, so you will find this is arthroscopy, not arthroplasty. Here it is arthroplasty. So arthroscopy code is there. So it is not possible. It's a wrong code. So the correct answer was 23474. This is very easy question, guys. You will get this type of question also. So guys, next question is Mike had a bicycle accident and suffered deep hematoma in both knee. He underwent bilateral incision and drainage. How would you report the procedure? So it's very easy question. I hope. Like here you can see the patient had suffered a deep hematoma in both knee. The location is both the knee, and he underwent bilateral incision and drainage. So how would you report? So so first of all, if you can focus on question options, you will see the 27310 having 50 modifier, but other than this option you can't find 50 modifier. So the more probably answer will be A. Why? Because 50 is bilateral procedure modifier. So we will check the CPT description. 27301. 27301. So 27301 is incision and drainage, deep abscess, bursa and or hematoma, thigh or knee region. So knee region, and here hematoma in knee. So the code also correct, but still we will check other description also, other codes also. 10040. So 10040 is acne surgery. So it is not an incision and drainage. So the option B eliminated. Okay, then now we will check out option C. 27303. 27303 you can see here below. Incision deep with opening of bone cortex, femur and knee. Okay, so this is not incision and drainage. See, in 27310 you can see incision and drainage, INT, but here 27303 is only for incision, not for drainage. So this is not appropriate. So you can eliminate C also. So we have two options only. One is 27310 having A and D both having same CPT code, and because of modifier 50 we will go with option A. So the correct answer is A, 27301 with 50 modifier. So like that, guys, it's very easy to find out correct answer and try to eliminate more. So if you eliminate one or two option, then eventually you will come to know the correct answer. So I hope this video is helpful for you guys, and I will update next video as soon as possible. So stay with me and like, share, subscribe Medical TubeMate. Thank you so much.